So welcome to Discharge Summaries Focus Group. Thank you all for attending. Today's main focuses will be, go to the next slide, some PAS support updates. We will have a little highlight on MasterCare Plus and what's new. Marina's here to provide some template creation training because I think a few people have requested some more training on how to create templates. We will also go through current reports and some reporting related topics, and then any questions and closing remarks. Feel free to use the chat to ask questions. I'm not 100% sure if I can see it, but if any of my team can shout out the questions or do shout out throughout the presentation. Tanya, did you want to say anything?
Sure. I'm really excited about this group because discharge summaries we know are something that every hospital needs to complete and upload to My Health Record. It's never easy. The Australian Digital Health Agency is actually working on legislation where discharge summaries will need to be uploaded regardless. So we will need, as citizens, to opt out rather than opt in. So it's super important that we get this right. And we know everybody's been struggling. So really quite keen to see how we can support you doing work better, smarter. So thanks, Phoebe.
Thank you, Tanya. And Emily, anything from you?
Nothing on discharge summary really, but I think it's a great idea that we're having a focus group. Really good to see you guys here and to listen to you.
Thank you, Emily. Okay, well, I guess we'll kick start. So introductions, I've just got a list of us who are here. So Emily and Tanya, you know, and myself. Marina, as I said, she will be providing some training. We have Rania, who is our customer support manager, who I'm sure you speak to quite a lot. She's not actually on the call, but one of the main contacts you should know. Princess, you probably all know Princess as well, our customer success officer. She comes to you with all of the tickets. And then Ilaria, who is our innovation lead and consumer portfolio. She is also a great contact to know if you ever want to know a bit more about digital front door or something like that. Okay. And then you have the PAS team, as I said, Rania. Then you have customer support, Tamer, Naveen, Matthew, and Sandhya. Oh, I'll just fit someone else in. Lovely. So those are all the names that you should maybe know. If you don't already, make a little note. Okay. So first question, have you scheduled your PAS upgrade? So you will have received an email. I think the next slide. Yeah, you will have received an email about the PAS upgrade, and there is some changes that are mandated from the 1st of July. So to ensure compliance, please upgrade your system before this date. I don't know if anyone can pop in the link in the chat because I can't get into the chat right now. But we'll pop the link into the chat for the upgrade, or you can raise a ticket, or there is a link in the email that you will have received from marketing. So yeah, please do schedule in your upgrades. Yeah, so just a quick overview of what's new in MasterCare Plus. Just some changes that have come into the MasterCare Plus software that you are able to upgrade to or purchase if you feel that you need these features. So firstly, we have some Power BI reports which are available to MasterCare Plus modules. So this is more in the billing section and the appointment section. So we've got an aged debtors report. We've also got the receivable invoice summary and receivable invoice detail, as well as a Power BI booking report, which allows you to filter by client, staff, location, team type and status. So they can all be extracted into CSV files, but also with the Power BI tool, they can be made into kind of fancier looking reports as well. Emily was also just going to jump in and talk about some other features to inpatient modules. I think if she's there.
Yeah,
thank you.
Thank you. Just first of all, yeah, the email went out, Lyndall, to the following email addresses. Now they may be getting blocked as it is from marketing. Put them in the chat, but not to worry. You can go ahead and log a ticket if you want to do the upgrade.
Thank you.
No problem. And I'll make sure that you maybe follow up with your IT. Gosh knows where they are getting blocked. So in terms of MasterCare Plus, what we're doing now, you can see some of the new features here on the pause screen. We have the episodes and encounters up on the left-hand side, and it's a little bit different as, you know, it's a SaaS solution and maybe terminology can be a little bit different. So sometimes can be, it's not scary to look at, but it's certainly interesting to see the differences. On the bottom, you'll see the adverse clinical outcomes, just a tab open there. You see some of your other tabs here. Your episode details, bed transactions, and more. We're working on those now. Just go forward, Phoebe. You can see also the debtors section up in the top in accounts, and this is just a quick snapshot. A little bit more in the middle there on episode details and bed transactions and more. And on the left-hand side in the bottom, you can see some widgets for bed availability. So these can also be used for referrals, for ward availability, for the bay availability, and for a lot more. Your locations can be set up and given you a visual. So that's just a quick snapshot into what we're doing. Lots of exciting things coming over the next few months in terms of the EMR and PAS here.
Thank you, Emily. Yeah, so if you do want more in-depth demos on any new features, then please do let us know. We'll be happy to walk through with you. Okay, so now we're going to get into some of the training part of this call. So I'm going to pass over to Marina and stop sharing my screen, who is going to run through creating templates. Marina, I think she might be frozen.
No, I'm here. I'm just trying to share my screen.
Yeah.
Thanks, Phoebe. Sorry, everyone, for my voice. I am struggling through a flu. Can everyone see my screen?
Almost, it's loading. It's just your face at the moment. Oh, there we are.
All right, perfect. Alrighty then. So we'll have a quick training over templates and how to design your own templates. First of all, you know where to access your templates is from the little icon here, and then you go to templates. Once you click on templates, you will have a list of default templates within the system and also the templates that we've configured for you before you go live. You will have the discharge summary template, which you can edit. You can give it a name. If you want to change the discharge summary name, you can give it a name. And you won't be able to change the apply to section if you are already in a configured template, but it would be good to choose a discharge summary template as well if you are doing a discharge summary template. It's very important to assign the template to teams. So if I remove this team from here and go into teams, I can select a specific team to assign the template to, so only the team that will be generating the discharge summary can be assigned, or I can select all teams and assign all the teams within the organization or within the hospital to generate the discharge summary. You can also assign certain users to only use this template, or you can select all users. If you want to have a template, if only the discharge summary is going to be used by one person, I know this might not be very relevant in hospitals, but I just want to go through all the options that you have here in the on this page. So if only one person is using the template, you can use a single authorized document. It's not letting me click here or check this box because I've marked all users. So if I have a single user, I can mark this single authored document, and in that situation, only one user will be able to access this template and edit this template. If I want to associate my letterhead to this template, I'll just check here the use letterhead as well. FYI, letterheads, same configuration, design ideas, which we will go through, but here is where you can access them. The first effective date will be the date that you create this template in. And last effective date, if you want to, so let's say you're going to be redesigning the template. I know that I'm going to be using a new template, a new design, or I'm going to have a new logo on the 26th of July. If I put here the 26th of July, the template will be inactive automatically on that date. So you will no longer see it on the front end. So that's one way to make it automatically inactive on a specific date if you want to. Please stop me if you have any questions. I tend to forget if anyone has any questions, so please interrupt me and feel free to interrupt me anytime you want. In the discharge summary template, you've got the headers, you've got the body of the template, and then you've got the footers. We'll start with the headers. In the headers, most of you guys, when we were designing your templates for you, you've requested for your logo to be here on the left side of the header and for the client details to be here on the right side of the header. The middle part of the header is normally either empty or might have the name of the hospital in small writing. So it's all up to you. But let's add here the logo of the organization. There's multiple ways you can do that. You can insert an image by clicking on the image icon and clicking upload and browsing from your computer. So I click browse for an image. Will take me here and I can select my image, open. It will give me dimensions. I'm not technical. I don't know what these dimensions mean. So I just click OK. It's uploaded. I feel like it's too big, so I'll just make it smaller. And I'll feel, okay, this looks like a reasonable size. Another way you can do it, so if I delete this, another way you can add your logo is by simply dragging. As you can see, I'm dragging the icon from my desktop, again to the header on the left, and then I minimize it to the size that I want. This is how you can add a header. Let's go to the right-hand side here and add the important or the mandatory data to be on a discharge summary. So normally it's the name of the patient. And there is a trick here. So if I click enter, you see where the writing will be, where the typing is too far low. But like there's a big space between the name and the text and text. So what I normally do is shift enter, and then I write the next line, and then shift enter, and then that. For the name, I go to bookmarks. You'll find lots of bookmarks. Bookmarks are ways to auto-populate information into your template and let it show on the front end. So I want the client's full name. So when I hover over the full name with my mouse, you can see I've got first name, preferred name, surname, and so forth. But I want the full name. So I will just click full name, and you will have the code here for the full name. Go date of birth, client, and date of birth, and then address, client, and full address. I personally believe 11 is a very big font for the header, so I would go 8, and then You can have these as bold as well. It just looks prettier. Other thing I normally try to do is, you see how here Verdana is the text or the font? I would normally like to Control A, so highlight everything and make it all Verdana. It it looks better once you print it, for everything to be the same font and the same size and so forth. Another trick we normally do here, some clients request a lot of information to be on the header. And in that case, if the client's full name is too long, for example, it might be going down to the line beneath it, so it doesn't look good. So one thing we do, so I'll just move everything at the bottom. One thing we normally do is add a table. So I'll add a 2-column table like that. Add the information, so I'll highlight it, drag it, and drop it. Something like that. But having a table here does not look good. So I click on the table with my left button on the mouse, and then go Table Properties, and then go into Advanced. Border color, I want to make that, instead of black, I'll make it white. That's the code for white. Just make sure it's that. You click OK. If you click OK, it's like an invisible table. So things do look good once you print it out and the table does not show as well. Any questions so far before I move on to the bottom of the template? Alrighty then. For the body of the template, we have, of course, the most famous bookmarks. Here's for the mandatory data that needs to be submitted for MHR. So all this information can be found here in the Encounters tab, and you can pick. You can pick what you want to include to be in the discharge summary that you are printing. So as you can see, you have the Encounter the Diagnosis section, Procedure section, the Clinical Summary section, and all those. You can, of course, like follow-up appointments is not mandatory, so if you don't want to include that, you can remove it. It's up to you. This table here is the default look for how we present the discharge summary, or the default setting. You don't need to have it, but again, this is how the Encounter the locations, again, everything is presented, and here are the bookmarks. The other thing you would like to know, which is useful, of course, you know that here, as I've presented, you have the bold, the italic, underlining, bold, italic. You can cross something out. I've never really seen anyone use superscript and the subscript, but they are there if you want them. You've got formats as well. So you've got the heading formats. So you can choose something like that, either the same ones, and then it's like a Word document. So very similar to a Word document. And of course, our undo button and the redo button. You have the options for bullet points, and you can have different shapes of the bullet points, or also 1, 2, 3, sections. Sorry, my brain is not fully there, but yeah. You can change the text color if you highlight something and change the color of the text. You can do that, or you can highlight it by changing the background of the text. The most important thing, okay, before I say the most important thing, this is inserting an image, so it's the same idea as what we presented here with the logo. We have the other thing worth mentioning is the checkbox. So I can put a checkbox here, and on the front end, while you're doing the filling in the template, you can select it. So there's lots of options you can do here, and of course your bookmark if you don't want if for example the current medications is a long list and you don't want them to be on two different sheets, you want all the current medications to be on one sheet, you can use a page break. So if I do that, I can enter a page break, so the current medications is on one page and then the ceased medications is on another page, for example. Back to the most important point. So whenever you are putting in a table within a template, always remember, especially if you are printing out this discharge summary to give it to your patients, always remember to click on the table with your left side of the on the mouse, left click on the mouse, go to table properties. You see that width? Never have it as 100%, always have it as a 99%. This makes a huge difference in the paper and your discharge summary being printed as landscape or portrait. So this 99% is crucial, and it also, if not only printing, but if you're downloading it or previewing it as a PDF, always go for a 99%. So the way I configure templates is after I put all the information in, everything's done, make sure the font is all the same, the font is the same size as well. I make sure all my tables are at 99%. You have extra table options here, deleting, adding rows or columns, deleting rows or columns, or deleting the whole table. So these are all options here. And also not only that, but you also have that same thing. If you right click, you will have these options for each cell as well. So you will have cell properties. So I can have a table with I can merge cells, or I can have this cell, for example, invisible if you want. So a lot of things to play around with when you want to design your template. The signature here at the bottom, you can also have them from the encounter sorry, from the encounter bookmark. But you can also, if you want, have the team's signature, discipline, email, and so forth as well. The logo, some organizations or some hospitals like to have logos for different teams. So you can add a logo to your team in the admin configuration in your teams when you're creating your team. Any questions about the body of the template? We've covered everything. There's more bookmarks here. We'll cover these at the bottom, but yeah, more bookmarks about the team and the user. If the user wants to have their email and full name on the discharge summary, they can do that as well. Any questions? For the footer, normally we would have the team's email or fax number displayed here. Fax, shift enter again, and email. And on the right side here, we would have the page number. So with the page number, I normally like to have it in the middle, because when I have it on the right, if it's page 1 out of, like, say it's a huge discharge summary and it's like up to 100 or something, It will be broken up into 2 lines. Doesn't look good, so I normally like to have it in the middle, and it does look good on the side when it's on the right side of the page. So that's just my recommendation from all the templates I've been doing. Again, make sure your text is all at 8 and the same font just for better presentation. And if you need, sometimes you would like to add a disclaimer here or something. If there is something you would like to add, you can add it in the middle section of the footer. Once everything is done and you like everything that you've added here, oh yeah, I forgot I had a table because it's invisible, but here we go. Once everything is added, you just save and exit. You will need to go into a client and generate a discharge summary. So I don't have MHR on in this tenant, but you will need to go into a client, generate a discharge summary. So open up an encounter or an episode, generate a discharge summary, and see how it looks. And that is it for templates. It is important also to know that there are 2 types of templates. You will see the templates that you have generated, like the design and everything. This is for the PDF and what you're going to give to the patients and all that. But whatever you're going to be uploading to MHR is a CDA template. So it does look different. And that's not really our design or the systems. It's what we have to supply for MHR. So that is all for the templates training. Any questions? Not question.
Yeah, I will if I can, thanks. So we've got we have multidisciplinary teams who have their own templates, and we drag it into our final discharge summary. Some of their individual templates have tick boxes where they tick it for risks. How do we insert those tick boxes?
So I'll just use this one, the check box.
Yep.
So if you go anywhere and click insert checkbox, you will have that box.
Ah, that easy. Okay,
Yeah.
thank you.
Yeah,
Yep.
no worries. Any more questions?
No, I think
All right.
all good there. I'll reshare my screen and we can go to the reports section.
There you go.
Thank you. Okay. And Marina will do the speaking. I'm just presenting. There you go, Marina. Thank you.
Alrighty. So as you can see on the screen, there are multiple reports that you can generate for MHR that would be useful for you. So, okay, how do we do this? Because I do want to share my screen as well. But all right, let's go through. Yeah, let's go through what's on your slides, and then I'll share my screen.
Also, I don't know why this is upside down. That is a formatting error. Do apologize for the upside down section there.
That's all right. So there are multiple reports you can generate that can help with knowing what has went through to MHR, what has failed to upload to MHR. Has anyone viewed MHR or downloaded anything from MHR? So these are example of reports that are there. Phoebe, I'll just share my screen again if that's okay.
Yeah.
Alrighty then. So as you can see, can everyone see my screen? Yeah. Alrighty. So how do we get these reports? You get them by going into your reports section and then clicking on audit logs. Once you click that, you will get this filtering section here where you can search for a certain thing or activity, events, features. You can search for anything or keywords. And then you've got your range date. You can search by staff if you want to know what that certain staff member did throughout the whole system or regarding MHR. And I'll show you how to filter that. You can filter by events and then by features. So for MHR, I would go here, click MHR. If I click search here, let's just go back with the dates a little. So I'll go back a year, nothing happened in a year, 22. Alrighty, so if I just click MHR and click enter, it will give me all the activities that happened on MHR within the system. As you can see, it's a huge list. So of course you can use your sort by date or group. You can group by event or staff members as well. So you can use, or even by the IHI or HPII numbers. So you can use all these filters to better view the list or this filter as well. So let's, for example, group by event. Click apply. You can see who has viewed MHR. You can see, does MHR exist for a certain patients in your system? You can see if upload has happened or if upload has failed. I think these are the most two important reports for you. So to get a better view, let's go here. So you'll have in the features, you'll have MHR, and in the event, you'll have upload, and then you click search, give the time frame that you want to check in, and this is all the uploaded documents that have been to all the patients that have been uploaded to MHR. It gives you who has uploaded it, what's their team, and the date and time of that upload. But you also can view the upload failure. So if there is a couple of discharge summaries that you've tried to upload and you're not sure whether they have uploaded or not, this is how you can search for them. Another way you can see those upload failure is if you go to your notification tab and if you look for recent activities. I think it was in this done it. Yeah, this done it. So if you go to your notifications tab, you'll see documents that need manual delivery. If you click on that, yes, Donal, you can. I'll show you that as well. If you click on the documents that need manual delivery, you will see that one of these messages here will tell you was not able to upload to MHR. And it will ask you, do you want to resolve it? Or do you want to download the discharge summary and basically upload it in whatever way other than that you want to do? But it will ask you if you want to resolve this issue. And once it asks you to resolve the issue, it will give you the issue like, for example, patient does not have an IHI number. User that signed the discharge summary did not have an HPII number. So it will list the issue for you on why it wasn't uploaded to MHR. In the upload or upload failure, so, oh, sorry, here, upload or upload, let's go back, sorry, 2021, MHR, oh yeah, sorry, wrong tenant, sorry. Yeah, that one. Upload failure. All right. to answer your question, Danelle, you have the upload failure report. You can download it to CSV, and then you can print it. So this is the way you can print. So as soon as I click here, it's downloading. If I open it up, you will have the Excel sheet with the information. Sorry, my laptop is opening up the Excel sheet, and you can download that Excel sheet. Here we go. It's opening up. All right, so just move my Excel sheet here. And as you can see, you can download it. It shows you the HPII, HPIO, the staff member, the event, the date. Yeah, so it shows you a lot of information that you can have within in that report. And that is it.
Were there any questions about the reports from Marina whilst we've got her?
Oh, I have a question.
Yeah.
The report that you just showed us that you printed out, does that identify the UR number or the admission number at all?
No, it does not identify
Just the user.
Yes, just the user.
Okay.
Got another question. Has this feature been launched, as I don't have this report feasibility and I have admin access?
Right, you have admin access. I will need to. You have.
Hi, Marina. It's Carrie.
Hi, Carrie. I think
How
you
you
have
doing?
super administration. I'm
Super,
good. How
whatever
are you?
it is.
Yeah, super.
But
Super
I don't get
administrator.
to see anything that you were doing. I was mimicking or
Okay.
had the report section open, and I was trying to mimic what you were doing, and it was just not coming up with anything for me.
I got 3 errors, and on the 4th attempt it showed for me. So did you just get those errors pop up on your screen?
No, I didn't get errors. I didn't even get the filtering components available.
Yeah, I had to try 4 times and then I got it. So that may have been it, but maybe not.
I'll have to look into your permissions, Carrie. Does anyone else have those view, or is it only you that can't view them? So does Danelle and Tuin have those viewers? So can they view the reports, or is it only you that can't?
I can look, Carrie.
Yeah, if you could, Jean.
No problem. I'll have a look.
Thank you.
Have a look, let me know, because if it's only you, then I'll check your permissions. If it's everyone, then yeah, we'll need to investigate.
Then it's
Thank you.
Yeah,
still for us identifying the person that hasn't been uploaded. So we can identify the person that uploaded it, but not the patient, if we don't have anything to track back by, like a unique record number.
So
does it have the patient name?
It has the patient name and the ID that's on. So yeah, the ID for the patient.
Okay, so
not an episode ID, but the patient ID.
Patient name.
The patient name. So we'd still have to be going back to get the right patients, make sure that they're the right people by cross-identifying names and.
Does it not have the ID number as well?
In case we have people with the same names.
But does it have the patient ID number as well, Marina?
It does, yeah.
Yeah.
The ID, which is the UR number, is that right? What's the ID number?
UI number.
UI number. So did you mean by your first question the UI number per patient or per, I thought you meant per episode.
There's 2. There's the admission number and then there's the unique medical record number.
So the unique medical record number, that's there on the table, but the admission number is not.
Okay.
Yeah.
Sorry, Marina, can you show me again how to confirm the My Health Record? It's been uploaded to My Health Record, because I've done all the filters and I've just got a whole heap of does not exist.
Does not exist. So,
Yeah.
so can everyone see my screen again?
Yep.
Yeah.
So let me start.
Upload failure. Okay, that's what you
Upload
use.
failure is for the ones that didn't go through. And then for the ones that did go through, it's uploaded. So you can
Okay.
generate.
Yeah, let me just
generate both of them together if you want.
Uploaded. Okay, let me see what I get.
And then MHR for the feature.
Yeah, I've got that one.
Yeah.
Okay.
Do you want
All
to
right.
show
So I've
the-
got name, MRN, and yeah, I've got patient name and their MRN on my uploads.
Okay.
And the nurse that uploaded it.
Okay. Great.
Does that help, Jean? I think that was something we discussed previously.
Yeah.
Yeah, amazing.
Thank you.
Okay. Any other questions? Are there any other reports you'd like to see whilst we've got Marina? Sorry. Any other filters? No. It might be worth just playing around with as well, when you've got some spare time, just to see what else you can pull out of the system to help with any reporting. Which also leads me on to, in terms of reporting, this is something we wanted to discuss today as well, just to kind of get your feedback on what you kind of need from the system for any compliance, and what is kind of would really help and what's a nice to have. So we have had some requests for the following three, and we just wanted to get the feedback from the rest of the group whether everyone needs these items or if one in particular really stands out for everyone. I am conscious that two of the other discharge summary users aren't here today, so we can't get their feedback. So this is something we'll discuss outside of the group as well, just to make sure it's fair and we've included everyone. But just as a kind of discussion point, yes, these are the three kind of requests we've had, and we just wanted to see everyone else's thoughts and feelings on these, and which one would be the priority for everyone. So I might read it out because it's probably a bit smaller than text. So we've got an admission specific MHR consent field. So you can't currently link consent to an individual admission. So that's like an episode. So there has been a request to have that linked to a specific episode for more traceability.
Can I just jump in there though? The consent may change between episodes. Someone may consent, and then the next time they come in, they may not consent. So wouldn't you just change it then?
Yeah, so each episode you'd have a consent box. So you'd tick consent for the first episode, say if they broke their leg, and then for the second episode, they may come in for Where
would you tick that? Because it's currently captured under client details. So you would just go and update client details, wouldn't you?
So the request is to have a tick box within the episodes. So we would create another tick box for you.
Is that going to sync into the consent in the client details that automatically sends it to My Health Record, or doesn't? Or is it just an extra tick box?
It would have to, yeah. So that, if that one's more of a priority for you. Or the upload report. So this would display MRN, admission number, consent status, and upload success. So from the report Marina just showed you, I think the only thing missing there is the admission number. So that would be another report we could look into generating, depending on what kind of takes priority for everyone. And then the My Health Record consent report. So this would just be a list of patients who have provided consent to My Health Record, which I don't believe is a direct report at the moment. So from the three there, also if there are any others that you can think of that you believe would be more beneficial, or you have some ideas, please do let us know, and we can use these kind of focus groups to see if everyone's on the same page and which one would be the most beneficial for everyone. So any comments?
I'm okay with how it's working at the moment, because we update it. We update it each admission based on what the patient consents.
Okay, so you just use the tick box in the client details.
Yeah.
And do you have a process that you follow to ensure that that's done each time?
Yeah, we've got it on our privacy consent. So the admin will then go from the privacy consent that the patient signed straight to client details and tick or untick it based on that. That's our process. Works at the moment. I wouldn't do an extra tick somewhere.
No. Okay, lovely. Thank you, Lyndall. Any other comments from anyone else?
There we go. Can you hear me now?
Oh, yes. Yeah. Thank you.
Okay. So I think just adding that admission number into that existing report that you just showed us with the failed upload would be really useful, and hopefully that's just a quick little turnaround. That one would be useful. Sorry, are you able to just pop that third one up on screen? And I'm just looking to my team as well on that third one.
Third one is the consent report. So just a report showing the patients that have consented to My Health Record.
Yeah, is that does that cover the need that we've identified, team?
I think so, Danelle. Yes.
Mm-hmm. So
I'm going to say something really, but isn't it a default situation? So it's not actually providing consent; it's the withdrawing of consent.
Okay, so it would be more a report on who hasn't consented.
Yeah.
Okay.
That's my take on things.
The legislation's changing at the moment. Well, the ADHA, Australian Digital Health Agency, is trying to get legislation through where we consent by default. It's not there yet, but that's the plan, that we all have to provide explicit notification that we don't want our record to be uploaded. So it's in flux at the moment.
Yeah. Okay. So having that as withdrawn consent would be, for the future purposes, would be fantastic.
Okay. Yeah.
And that's certainly how we've set up all our forms, that they actually have to withdraw consent.
Okay. Yeah.
It's great. That's anticipating.
Is everyone aware that if they go to in the banner, if they go to messages sent, it'll tell you the messages that have been delivered and failed as well, as a quick way to see what's been sent electronically? Is that to My Health Record, or is that to... No, don't. That's to our GPs. Ignore. Move on.
And the referral net ones, yeah. But thank you, Lyndall.
So Lyndall, can I ask you a question?
Yeah.
Are you doing paper-based uploads, or are you doing the digital discharge summary?
It's all digital. So we have individual templates by discipline: OT, speech, social worker, physio, psychs, whatever. They're all merged together. We've added a line in that discharge summary template called clinical documents. And so they opt in which documents they want to include in the discharge summary. And then when we generate the discharge summary, they're all included. And one of those includes a pharmacy discharge medication as well. So it's all digital.
And how did your nurses take to that?
Brilliantly. Yeah.
Yeah?
Yeah. Yeah, we've been doing that. We've been doing that for a few years now, haven't we, Tanya?
You have.
Yeah.
We have, yeah.
So we're just in the middle of, we're still quite paper-based. So we're doing a lot of this upload on paper-based scanning. The aim is to actually move to the digital component. So that's our next project that we're looking at. So we're just, it'd be useful even just to chat with you guys, offline at some stage.
Yeah, sure.
How you went through getting. We talk about breaking the. What do we talk about today, team? In the MasterCare, we talk about breaking the neural pathways. So we've always done it this way. No, we need to change the way we do things. So yeah, it'd be good to chat with you offline.
Yeah, all the disciplines were able to create their own templates. And as Marina showed, all the templates are very configurable. So they asked for tick boxes, they asked to bring in pictures and all that sort of stuff. So they've all got their own templates, and they're all merged at the end. So if a speechy doesn't see the patient, the speechy doesn't do the template. Yep. But, if the dietitian sees the patient, they have to do their template, included in, like, marketers include, and it's all included and merged at the end.
Okay. Oh, that's and for our team, that might help that, because at the moment we're only doing the nurse's discharge or event, we call it hospital event summary. So it's only the nurses who are doing it, but it'd be good to bring in and have a medical one that if they ever fill it out, fingers crossed, that could be useful too. So all right, that might be worth having a look at, guys.
Yeah, fabulous. Thank you. Okay, great. Well, that was really positive. I'm glad that we've had this discussion, and I think it would be great to bounce ideas off one another to see how you are utilising the system, and if you can take tips and tricks from each other to make it work better for you, because there's only so much that I can envision without being in a hospital setting and advise on, and I think the same for Marina and Tanya as well. So when it's actually being used in real life, you get so much more tips from the system. So fabulous. I don't know if we've got any other points to discuss right now. So any questions or any kind of feedback or anything you want to share, now is the time.
So a quick one from me. What's the plan moving forward for this user group? Because I think this will be quite a useful process.
Well, yeah, I guess that was up to you guys. So how would you like to utilize the user group? We can do it quarterly, or we could do it maybe. How often would you like it, really?
I like the idea of quarterly, because then that just gives you a bit of a chance to put in place kind of what the learnings are. Yeah. Would that be good for you as well, Lyndall?
Yeah, that's fine.
Yeah, lovely. Okay. We can do this quarterly. Absolutely. I'm happy to host if everyone's not sick of me. And we can bring up new topics each time. That would be brilliant. And we can send a sort of a questionnaire prior to it. Make sure we're focusing on the points that you want to focus on. I think that would be great.
Perfect.
Lovely. Any other questions or?
You just froze, Phoebe. You just froze.
I'm froze.
You're back now.
Oh. I said any more questions or requests?
So just to say, guys, after quite a few attempts, I finally got into the uploaded and not uploaded report. So that's good. Thank you.
Fabulous. Thank you, Carrie. Anything else from anyone? If not, then we can give you back the rest of your afternoon.
Thank you.
Thank you.
Thank you so much.